safety, quality, and accountability across the sector. Allow me now to turn to the other pillar, that is universal health coverage. Mr. Speaker, universal health coverage, UHC, is central to Beta's social contract. Equitable access to quality health services is essential for human capital, productivity, and poverty reduction. Towards this end, I have proposed 177.2 billion to the health sector to advance UHC and strengthen essential services. Key allocations include 8.6 billion salaries for UHC staff, 19.1 billion for primary healthcare fund to finance frontline services. Mr. Speaker, to reduce the burden of communicable diseases and advance immunization, I am proposing 18.5 billion for the Global Fund and 6.4 billion for vaccines and immunization program. This investment will protect children and communities and reduce health-related economic shocks. Mr. Speaker, tackling cancer and other chronic illnesses requires focused investment. I propose 3 billion to the emergencies, chronic and critical illness fund, 1 billion for construction of a cancer center at Kisii Level 5 Hospital, 300 million to strengthen cancer management in Kenyatta National Hospital, and 150 million for the expansion of comprehensive cancer center at Kenyatta University Teaching Referral and Research Hospital. These measures will expand diagnostic and treatment capacity across the region, given that we are leading as a leading hub in terms of health in this region. Mr. Speaker, to improve tertiary healthcare, I propose 45.3 billion for our referral hospitals. Additional targeted investments will include the following: 470 million for the construction of Kenyatta National Hospital Burns and Pediatrics Center, 300 million for renovations and replacement of obsolete equipment at Kenyatta National Hospital, and 2 billion for construction of a new 2,000-bed multi-speciality at Moi Teaching and Referral Hospital to expand capacity and improve health outcomes. Mr. Speaker, to ensure reliable supply chains and strengthen human resources, I am proposing 20.9 billion for Kenya Medical Supplies Agency, KEMSA, 3.1 billion for the Kenya Medical Research Institute, 1.3 billion for the Integrated Reproductive Health Program, 500 million for family planning and reproductive health commodities, and 600 million for equipment at the National Blood Transfusion Services. Mr. Speaker, as a country, we value the services offered by our health workers. To build workforce capacity, I propose 9.3 billion for medical interns, 10.9 billion for the Kenya Medical Training College, and 3.2 billion and 396 million for stipend and medical insurance for community health promoters, respectively. Under digital superhighway and creative economy, Mr. Speaker, digital transformation is a strategic enabler for competitiveness in the fourth industrial revolution. Digital connectivity and literacy are essential for education, healthcare, finance, markets, public services, and emerging digital opportunities. Mr. Speaker, Kenya's creative economy, encompassing film, music, fashion, arts, media, digital content, and design, has become a powerful engine for growth and youth empowerment. Investing in creative industries expands cultural exports and drives innovation. Mr. Speaker, to accelerate digital adoption and inclusion, I propose 8.6 billion Kenya shillings to this sector. And this will include 4.3 billion for Kenya Digital Economy Acceleration Project, 1.3 billion for maintenance and rehabilitation of national optic fiber backbone infrastructure, 528 million for maintenance and rehabilitation of last mile county connectivity, 309 million for government shared services, 382 million for the digital superhighway cybersecurity, 400 million for establishment of digital hubs, and 455 million for ICT infrastructure maintenance. Investing, now let me move to infrastructure. Mr. Speaker, infrastructure is the backbone of economic transformation. It provides connectivity, energy and water resources needed to power productive activities and sustain human settlement. By reducing transaction costs and opening markets, infrastructure investments deliver long-term value. Towards this end, I propose 220.4 billion for development of roads, including 44.3 billion to support construction of roads and bridges, 58 billion for rehabilitation of roads, and 118.1 billion for roads maintenance. This balanced mix supports connectivity, freight, efficiency, and long-term road preservation. Mr. Speaker, to expand railway transport, I propose 38.4 billion for railway projects. Additionally, Kenya shillings 400 million is proposed for the Kenya ferry ramp in Likoni, Mombasa. Additional 1 billion for development of public ferry landing ramps in Lake Victoria, including Mbita and Sena Islands in Suba North and West sub-counties of Homa Bay County, respectively. 150 million for acquisition of public ferry in Lake Victoria, completing the purchase of public ferry for use in Lake Victoria. And 582 million for Nairobi Bus Rapid Transport Project, which is a critical public transport investment that will reduce congestion and enhance mobility. Mr. Speaker, reliable, affordable energy is vital for industry and households. I propose 30.9 billion to the energy subsector, including 7.5 billion for the national grid system, 20.2 billion for rural electrification, and 3.2 billion for alternative energy technologies. These allocations expand access, lower costs, and promote sustainable growth. And I wish to add that a lot of energy projects will be financed through National Infrastructure Fund because they are commercially viable. And I want to turn to education. Education. Yes. Yes, I'm turning now to education. Improving education outcomes. Mr. Speaker, Kenya's future depends on developing strong human capital. And to this end, we will continue to strengthen quality learning, training and research, promote equity and inclusivity, scale up investment in education, fortify the system against emerging technological and labor market shifts, as well as fortify education to industry linkages, thus ensuring skills match demand. Mr. Speaker, I propose 784.5 billion for the education sector. Mr. Speaker, a lot has been said about defunding education. But in 2026-27, we are proposing 784.5 billion shillings, which is 26.4% of the ministerial budget. Compare that to 2021-2022 budget, before this administration came into office. The budget for education was 526 billion shillings. That has increased now by 49%. And it was 24.5% of the ministerial budget. Now it is 26.5% of the ministerial budget. Therefore, Mr. Speaker, it is not correct that this government, this administration is defunding education. In fact, we are funding it more. So this 784.5 billion includes Kenya shillings 424 billion to Teacher Service Commission for payment of our teachers. And that has moved from 290 billion in 2022 to now 421 billion shillings. Basic education is now 136. I'm proposing 136.6 billion. Compare that to 107 billion in 2022. 163.9 billion for higher education, which was 105 billion in 2022. 1.3 billion for science, innovation and research, and 58.5 billion for technical, vocational education and training. This comprehensive allocation safeguards service delivery and expands opportunities across the learning continent. Mr. Speaker, within this funding to the education sector, I propose 7 billion for free primary education, 54.6 billion for free day secondary education, and 30.7 billion for junior secondary school capitation. Those two lines, the free day secondary education 54.6 plus junior secondary education of 30.7 adds to a total of 85.3 billion. What was it in 2022? In 2022, it was 62.4 billion shillings. I also propose 9.9 billion for administering national exams, and that is in addition to what we have just provided before the end of this year to pay the arrears of 1.5 billion to teachers. So teachers who marked exams, they will be paid before the end of this financial